Okay, so step 11 is to assess or observe cognitive abilities. When we say cognitive abilities, it is their ability to think. Okay? Now, when we say cognitive abilities class, there are lots of things to assess, no? Mainly listed. Um, we will go through them one by one. Okay? One by one. First is orientation. Now, what we do is we ask the client to ask them to name their name, the names of their family members, the time such as hour, day, date, or any season, and place. This is to assess for their orientation. When we say orientation, Manggod, it is their awareness of their current situation. Okay? Like when you ask them, okay sir, what is your name? They should be able to give them your name. Diba? I'll give you their name, no? Dapat maka-provide sila sa ilang name. It's because it allows us to check, no, or to assess if they are oriented to their current situation. Okay. Now, normally the client should be aware of self, time, and place. Okay? Okay, that is normal. But abnormal findings include what we call a reduced sense of orientation or reduced degree of orientation. Okay? This is commonly found in patients who are undergoing what we call chronic alcohol use, and this is also found in schizophrenia. When we say reduced degree of orientation, they could be oriented to self, they could be oriented to time, but maybe not to place, no? Wrong? They could be oriented to self, time, or to but not to place. Or maybe they could be oriented to time and place but not to self. Or it could be self and place but not to time. Basta na ay kulang, no? If there is one that is missing out of orientation, they have a reduced degree of orientation. This is also seen in patients who are confused. Okay? Confused patients. Next is concentration. Take note of the client's ability to focus and stay attentive to you during the interviews. You ask them, no? What you do is you ask them to, or you give them a direction, like please pick up the pencil with your left hand and place it in your right hand and then hand it to me. The purpose of this the purpose of this command is to check if they are attentive to you by giving specific instructions. Like for example, left hand. Okay, pick up the pencil with your left hand and then place it at your right hand. Those are very specific instructions. And then hand it to me. Very specific instructions that test a person's concentration. No? So normally, the patient should be able to follow instructions well. Okay? Kuha na nila. They can follow instructions well. But abnormal findings include what we call distraction and inability to focus, obviously. Okay? This is seen in patients who are anxious, in patients who are tired, or what we call fatigued. This is also seen in patients with attention deficit disorders, disorders. And this can also be seen in drug / alcohol abuse. Ayan. Drug or alcohol abuse. Okay. Next is recent memory. Now, when we say recent memory, it is referring to what we call short-term memory. Okay? Short-term memory. Okay? You ask the client questions like, what did you have to eat today? Or what is the weather like today? Because it will actually test their immediate, or what we call short-term memory questions that test short-term memory. Like, for example, sir, sa magikaon mo, what did you eat during breakfast? Or sir, what did you eat during lunch? No? Normally, they should be able to recall without difficulty. Obviously, if you have no problem with short-term memory, you should be able to recall without difficulty. Like, for example, sir, what did you eat for breakfast? Makatubag din na. Normally, a patient will just answer, okay, ganyan buntag, sir, I ate rice with nagtosino sud ko, and then may egg ko, something like that, no? That is what we call a normal finding for recent memory. Now, abnormal finding obviously is the inability to recall events. Inability to recall recent events. Okay? Inability to recall recent events. That is seen usually in delirium or dementia ridden patients who are depressed, and also patients who are anxious. Okay? Next is remote memory. When we say remote memory, it refers to assessing what we call long-term memory. Okay? When we say remote, it means far away. No? Far away. What we do is we ask the client questions that test their long-term memory. Like, for example, when did you get your first job? That is an older, or what we call a question that tests long-term memory. Okay? No. Normally, they should be able to recall. Okay? Sometimes it may take a few moments, no, but they should be able to recall past events. Sige tawag nga past events. However, abnormal findings include the inability to recall. Okay? Inability to recall. This is commonly seen, class, in patients who have cerebral cortex disorders. Okay? Mainly among which, what part of the cerebral cortex? We are referring to our temporal lobe. Okay? Temporal lobe, which is the site in the brain which is where storage of memory occurs. Okay? Temporal lobe. Next is the use of reasoning, use of memory to learn new information. When before we test what we call short-term memory, long-term memory, this one class will test the third type of memory, which is what we call our working memory. Okay? Working memory. Okay, now working memory, according to your anatomy and physiology, is memory that is immediate. Okay, when we say immediate, instantaneous, right now in the moment. Okay? What we're gonna do is we have to ask the client to repeat 4 unrelated words. The words should not rhyme and they cannot have the same meaning. That is crucial. Okay? Ano na siya, class? Let's say, for example, I have 4 words here. Pink 30, pink 30, pink 30, water, and then stethoscope. Now, if you look at the words, they are unrelated words that do not rhyme and do not have the same meaning. What we are gonna do is, I will have them memorize these 4 words. I will have them memorize these 4 words, okay? Memorize these 4 words. And then I will ask the client to tell me or repeat these words in 5 minutes, and again in 10 minutes, and again in 30 minutes. So when I start the exam at 7:30, okay? When I tell the patient, okay, at 7:30, I tell the patient, okay? At 7:35, 5 minutes later, I will ask the patient. Ask patient. At 7:45, I will once again ask the patient. Okay, I will ask them, unsa man siya ng mga words. Remember, can you remember the words that we memorized? Okay, and then 30 minutes later, which is 8:15, we will also ask the patient lastly. Okay, magtanong na po nato siya balik. Sir, what were the words we memorized? Ayan, what were the words we memorized? Okay. Normally, class, the client should be able to do this. Okay? Normally, they should be able to respond this. No? Maka-respond sila. They're very instantaneous. Abnormal findings, class, include what we call inability to recall words. Okay? Inability to recall words after the delayed period. When we say delayed period, atong 30 minutes. This is often seen in patients who are, number 1, anxious once again. Problemado ka ng mga anxious class. Another is patients who are depressed. And also patients with Alzheimer's class, especially ka ng mga Alzheimer's, because Alzheimer's patients have lots of problems with memory. One of those problems is problems with working memory. Ayan. Okay. Next is abstract reasoning. Okay, when we say abstract reasoning, it is to ask them to reason out, or ask them to, or assess their ability to rationalize. Okay, assess their ability to rationalize. No, we can, how we do this test, we can ask the patient to compare objects. For example, how are an apple and the orange the same? How are they different? Okay, so maybe the patient will answer something like, apples and oranges are fruits. Okay, apples and oranges are fruits. Apples are red and oranges Oranges are orange, obviously. Gago din ha. Orange, no? So, wait. Okay. Apples are red and oranges are orange, no? With this statement, no, the patient is able to compare those two objects and provide a rationale on what makes them similar and different. Okay? So normally this is what will happen, okay? Normally this is what will happen. They are what we call able to explain. That is the key word there. Explain similarities and differences. Okay? They are able to explain what we call our similarities and differences. Okay. The keyword there is explain, because if they can explain, meaning they can rationalize, or they have rationalized, or they have reasoning to their answer, di ba? They have reasoning to their answer. Okay? Obviously, abnormal findings include an inability to compare and contrast, di ba? Dili nila kaya, no? This is often seen in mental retardation. This is often seen in patients who are delirium and also dementia. And this is also seen in schizophrenic patients. Now, one of the key characteristics class of a schizophrenic patient, no, as we've said, is they will what we call lose grasp of reality. Lose grasp of reality. Now, that is a consequence, no, of schizophrenia, because they lose grasp of their reality. They will lose their rationality, or their ability to explain what we call their situation, no? Next is judgment. Now, judgment basically means their ability to decide. Now we are assessing their ability to decide. Now, what we do is we ask the question similar to something like this. What do you do if you have pain? Okay? What do you do if you have pain? Now, okay? Ano na siya, ha? Here's an example. There are two choices. Let's say, for example, there are two choices. Not two choices. Okay? Na two possible outcomes. There are two possible outcomes, not choices. Okay? The first is, the patient could say, I will take meds. Okay? Tumar siya tambal. The other is, I do not know. Ganyan. That is your patient. Okay? Now, this is a normal outcome. This is a normal outcome. Because, wait, ato sumpayan. I will take meds because meds make the pain go away. Na, this is a normal outcome. Okay, this is a normal outcome. Because they are deciding that they will take meds because they know, or they have a reason why it works. They have a rationale. They have a rationale on why it works, di ba? There is sound judgment, no, based on the rationale or the reason as to why they are gonna do that decision. But in people who are impaired of judgment, in people who have impaired judgment. Like, for example, a person answers, I don't know. Impaired judgment. Okay, impaired judgment. This is seen in patients who have mental retardation. Mental retardation, emotional disturbances, especially class no, I want to highlight emotional disturbances. Kaya mo kung mga emotional disturbances mong good, it can what you call this, it can murag makatangtang siya, it can remove your sense of reasoning ba or rational decision making, no? So ma-irrational mong good ka. What will happen is if you are emotionally disturbed, let's say for example you are very sad or very happy, no, even very happy, no, what happens mong good is you will lose your reasoning, you will lose what you call your logical reasoning. So that way appeal po na siya, no, ma-impair po na nga tong judgment. And this is also seen in patients who once again have schizophrenia. Schizophrenia, class, balik lang tayo ng schizophrenia. And lastly class is visual, perceptual, and constructional ability. When we say visual, perceptual, it is their ability to sense using vision. And when we say constructional ability, it is their ability to create. Ayan. So, ang mahitabuan na class is from sensory going to what we call a motor action. Diba? Okay, so what we do here is we ask the client to draw a face of a clock or copy simple figures. Now, aside from asking them to draw the face of the clock, we should also ask them to draw the current time. Okay? Ask them to draw the current time. This is to assess once again if the orientation assessment you did earlier was correct. Okay? So for example, I tell the patient, okay sir, draw a clock. Ako anak ko. Okay, what time is it today? What time is it right now? So mayroon ko da 2:12. So butan ako small hand na diri nasa 2, and then the 12 hand is around here, ana. Kana no. So that is a normal finding, di ba? Normal findings include the ability, no, or they can draw fairly well, tapos correct sa ng ilang correct time. Or if you are gonna use, let's say for example, copy simple figures, you're gonna ask the patient, okay sir, draw a triangle, and then draw a square, and then a circle. That is also normal. A normal finding includes what we call can fairly draw instructed figures. Ayan. However, for both, okay. However, for both, okay. However, for both class, no, there are also abnormal findings, chief among which is the abnormal finding is once again an inability to do simple tasks like drawing a clock or copying shapes. Okay, that is abnormal findings kana. This is seen commonly in patients who are mentally retarded. These are seen in patients who have dementia. This is seen in patients with what we call a parietal lobe dysfunction. Namuta naman ako, sir, why is it parietal lobe dysfunction? Parietal lobe dysfunction. Simply put, no, atong parietal lobe, my God, it is housed, no? It houses lots of sensory neurons. Okay, so these are the neurons that will sense, no, or be aware of our external environments. Now, since this is visual perceptual, if you remember, it should have been what we call our occipital lobe. Okay, naman dito atong vision, no, but still, no, the sensory information will still have to pass through your parietal lobe before it gets back to the occipital lobe. Ano na siya? Okay, and with that, we are